Now we're going to talk about common injuries in wrestling. So what's unique about wrestling? You may be familiar with wrestling. So with wrestling, there's a lot of close contact between the wrestlers, and they get bent and moved in all kinds of different directions and twisted around. Sometimes you stand back and like, oh my goodness, wrestlers pop up and like, how were you not hurting after how you just got twisted there? And with wrestling, there are disqualifications, right? Both for breaking the rules and disqualifications for skin issues and if you don't meet certain weight requirements, okay? So those are all things to keep in mind. Just remember, with wrestling, even though majority are males, you can still see relative energy deficiency because weight is such a focus on wrestling and getting into a certain weight class. All right, so common musculoskeletal issues are shoulder and elbow in wrestlers. What we're going to talk a little bit more about is something that's a little bit more unique to wrestling, which are common skin issues, okay? And why is that important? Because in wrestling, if you have certain skin issues, if it hasn't been treated for a certain amount of time or treated a certain way, they won't be able to wrestle, right? Even if the skin issue isn't considered serious, right? There's this logo here, the National Federation of State High School Associations has come out with a list of skin conditions, and based upon what those skin conditions are, they tell you, yes, they can wrestle, or they have conditions. They can wrestle if they've been treated for this, and if the skin lesion looks like this. So we're going to go through just a couple of examples just to give you an idea. You don't need to necessarily memorize this, but just be aware of it, all right? So here's the first skin condition. This is tinea, all right? Also more commonly known as ringworm, okay? So what this NFHS says, you can wrestle, so if a wrestler has this, they can wrestle if it's been treated for 72 hours with either an oral or topical antifungal. If it's on the scalp, they have had to be treated for at least 14 days with an oral antifungal, okay? It may still be present, but as long as they've been treated for that period of time, then they can wrestle, all right? What's this? Well, this is just a common wart, right? Common wart because it's common. There's a lot of people with warts. This is not considered infectious, okay? So this, they can wrestle. They just recommend if it's prone to bleeding, just cover it with, a Band-Aid and maybe some tape, okay? Well, what about this other common condition? This is herpes gladatorum, okay? So this one is a little bit more complex. You can see there, if they've had it, if it's their first time having it, they need to be treated for at least 10 days with an oral antiviral. If it's their second or subsequent time of having it, only needs to be 5 days. They need to make sure they don't have any new lesions for at least 72 hours. And all the lesions they have must be crusted over or dried. And they must not have any enlarged lymph nodes, okay? So why is this important? This is something that our PCPs can really help with, and so can trainers. And so let's talk about what we can do to help it. But the underlying principle is if you see one of these lesions, especially in a wrestler, just go ahead and start treating it, right? One of the things is, if you notice there, it had to be treated for X amount of hours or X amount of days. So if you see it, go ahead and start treatment, okay? So what can primary care providers do? Well, like I said, treat anything that's infectious, even if it's considered benign or not serious. So most of these are considered more benign skin lesions, all right? Another thing you can consider doing is scheduling the well child checks maybe right before wrestling season. And as part of it, check their skin and teach the wrestlers how to check their skin. And just be aware, if something pops up, you come in and let me know right away so we can start treatment right away. What about athletic trainers? Well, you can emphasize the importance of checking skin and checking it regular. And here on the right, this is the form by the NFHS that needs to be signed off by a physician saying, yep, they have this skin issue, they started treatment on this day, and so whenever the wrestler goes to a tournament, they bring this form and say, look, I've had adequate treatment, or look, this is not an infectious thing, or this is not, this skin lesion will not prohibit me from wrestling today, okay?